Well, good morning, everybody, and welcome to our next hour's conversation on the cancer crisis. My name is Rose Bentley. I'm Group Director of Clients and Strategy at Propeller Group, the Reputation and Growth Agency. And I am joined today by Catherine McDermott, CEO of Reframe, Leaders in Cancer Support, who have published a new white paper called Avoiding the Cancer Catastrophe. And delighted also to welcome Richard Leslie, VP International Compensation and Benefits at Salesforce. Good morning to both of you.
Morning.
And thank you everyone for joining us. Now, as if we don't need reminding, healthcare has been front and center of our collective consciousness since March 2020. But in all that COVID maelstrom, the fact is that 125,000 cases of cancer are diagnosed in the UK each year, according to Macmillan. And 56% of company employees, according to their same research, are more concerned about a cancer diagnosis now than pre-COVID. Now, contributing factors to this is, of course, how long they may now have to wait for treatment. And we've all seen what's happening with that in the news. But also worries which are consistent worries around the impact on their work, their families, and their income. So I want to just take a turn to you, Catherine, first, because if it takes a village to care for those suffering from cancer, which of course it does, we all need to talk about how employers should be thinking about reducing the impact on those affected and the business. And we've seen a lot, of course, about how COVID's impacted diseases like cancer and waiting lists. So, Catherine, just starting with you, what do you see as the real impact for cancer in this landscape? What is the cancer catastrophe at the moment?
Okay, thank you, Rose, and morning, everybody. So if I just maybe set the scene, first of all, it's estimated that 3 in 1,000 people who are in employment are going to be diagnosed with cancer. And that means that 1 in 2 of us are likely to get cancer at some stage of our lives. Most common types of cancer are breast and prostate cancer. And so actually to employment age, it means that actually women are more likely to be impacted with cancer than men, both because of the prevalence of breast cancer, but also because they're more likely to have caring responsibilities. So the cancer impacts people at working age significantly. It's not just an old person's disease. And as you said, Rose, cancer is actually one of the top 3 worries of people at work in terms of their well-being. And the impact of someone who's being diagnosed with cancer is significant within the workforce. Even if it is only 3 in 1,000 who actually maybe experience cancer, we estimate that more than 50 people are in the result of that for each person who's diagnosed. So that can be everything from the HR managers who are specifically involved in sorting through the personnel issues, to their line managers, to people who are actively involved in managing their health, to all of their colleagues who are working alongside them and are obviously worried and concerned for their well-being. And then, of course, there's the practical things like 22 days sick a year on average lost because of cancer, and double that because people are worried. So even before COVID, cancer is one of those things that perhaps sits under the surface of the organisation, but actually can have very widespread impacts amongst the people who are working alongside someone who's diagnosed with cancer. And now we bring along the impact of COVID, and as you said, we know that waiting lists are getting longer. We know that the referrals are 11% behind where they were pre-COVID, and we know that there are missing diagnoses every month. That is causing a massive disruption in terms of how people are handling cancer. People are more reluctant to go and get themselves screened because they're worried about going into hospitals, and that means that actually if they are unfortunate enough to be confirmed with cancer, they are going to be going to have a tougher time actually dealing with that, because we know that early diagnosis is critical for good outcomes. But I think it's going to take more than 2 years now to clear the NHS backlog. So this is happening out in the workforce, and because it's cancer, people don't necessarily talk about it. So I think this is really something that people within employers need to really be aware of, and need to be thinking around how it is that they support people who are dealing with this situation.
And I suppose within this, and you know, where is the win for companies here in this issue? They will have so many priorities post-COVID. And I think you'd mentioned earlier that this is something that affects people of working age, but also many women, whether they are diagnosed or whether they are carers or involved in some way. So how does a company prioritize, and where should and why should they be prioritizing in amongst so many other things they have to think about?
So I think cancer is one of those moments that matter. I think actually you can tell a lot by an organization by how they support someone who is dealing with a life-threatening and potentially life-changing illness. And it can start from everything through just general awareness and being in a situation where people can actually talk about it and feel safe that they can discuss it with their employer. We actually have a client that we've been supporting for over a year now, who actually has still not told his employer that he has cancer because he's so worried about the impacts on his career of doing so. I think there's a creating a safe environment, and then there's making sure that actually you have all of the practical steps in place to actually support people to do that, from cancer policies through to the support that you might offer someone as they go through a treatment process.
So talk a little bit about that. But what are that there are many things that people with a cancer diagnosis find they need support with. It kind of extends beyond the most immediately obvious, doesn't it?
Yes, absolutely. So I think, if you talk about cancer, people tend to automatically think about the medical aspects, and indeed there is an awful lot of medical dimensions to this, from making decisions around what treatment to have, thinking about your own physical and mental well-being. So there are a lot of medical dimensions to actually managing cancer. But there are also a lot of other things. People are worried about their financial situation. They're worried about their care responsibilities. They may have children, they may have other loved ones that they're caring for, and they're worried about their ability to continue to do that. As I said, they may be worried about their job and their ability to continue to do their job. And then there are all the practical things. They might just be at some stages just really tired, and just getting some of the day-to-day things done that you would normally do in life just suddenly feels a bit overwhelming. So I think it's fair to say that cancer has a much wider impact than just a medical dimension to it. And I'd also say it's actually a really individual experience. We have everything from clients who are just give me some facts. I just need some practical details. That's great. I'm sorted. Thank you. Through to people who literally rely on our nurses to help them get out of bed every day because they are just so overwhelmed. And it is such a person. I think for me, that's one of the key pieces of advice I would be giving people. Whilst absolutely you want policies in place and standards that you adopt, actually it's really about tuning into what that individual needs in order to help them cope with their situation.
Thank you, Catherine. Well, I'd like to bring Richard in at this point. And firstly, Richard, congratulations on Salesforce being one of UK's best workplaces for 2021, which means obviously your employees are a big focus and loom large in any of your decision making and kind of future planning. In terms of your particular role and focus, from a employee's perspective, from a talent perspective, what kind of benefits are people looking for, and how has this changed since the pandemic? Are people leaning much more into health in general, and are you seeing that? Are you seeing a trend there?
So Thanks, Rose, and thanks for the opportunity to come and join in today. The the question of are things changing from the pandemic? We've thought about this a lot, and in many respects, things don't change. I mean, people still need to have a medical plan, they need to have a retirement plan, they need to have insurances, and so on. But I think what is changing is the way that employees engage. So things like virtual health become more important. And I think people also maybe just take time to reflect on what's important to them, and that can have a difference in what they think about in terms of their benefits. So for us, it's been a lot about the engagement, and I put that to one side. From there was a lot of pivoting to be done during the pandemic, just in terms of supporting, whether that was childcare support, whether that was specific medical support for COVID. But I put these as one specific bucket of things we had to react to in that time frame, as opposed to how is the landscape changing as we go forward. And the landscape's changing in respect from this working from home environment. Certainly for us, that is not going away. We're going to double down on I'm not saying work from home, but a work from anywhere, a success from anywhere environment, meaning that you in the office will be more about engaging and collaborating and less about doing the work. So if you think about that, how that applies to benefits, it is about the access to benefits. A lot of people would have actually had their benefits centered around their work routine going into a city centre, and maybe that becomes different. So remote access is probably the biggest thing that's changing there for us.
And I know you've been working with Reframe for about 2 years, and we'll come on to talk about that journey in a moment. From your perspective, from Salesforce's perspective, why should companies be putting initiatives like this kind of cancer support in place? Often there's talk about kind of ROI, and what do you see as the ROI on investing in staff welfare, and particularly for those diagnosed with cancer? Or should we even be thinking about ROI so much as return on people, ROP?
To be honest, we did not come at this from a return on investment perspective, and in part because I think it's very hard to measure. So the way we think about benefits is that we have core benefits, and I mentioned some of these earlier, like healthcare, retirement, insurances, etc., that we expect everyone to have. But we're a technology company, and in part, as in that technology market, we need to be competitive in terms of offering strong benefits to employees. But there's a more fundamental reason to it. That this is about company values and how you think about your employees. So the way we look at the benefits piece, aside of these essentials, we look at supplemental benefits. And these are benefits that not everyone is going to use all the time. So if I think about a retirement plan, it's just per employee per month, we're going to spend money on that plan. If I think about the supplemental benefits, it's much more about very targeted benefits that, frankly, I actually don't want most people to have to use them. So if I think about a cancer support, we're actually putting in something in place that we don't want employees to use. But the gratitude that you get for having done that is enormous. And whether it's the person using it, whether it's the people observing that it's being used, or whether it's just the fact that it's there, is just a support. So for me, there's a huge benefit to looking after your employees in that way in their time of need. So it could be a cancer support, but you think about fertility treatment. We know that only 1 or 2% of the population are going to use that, but the impact is enormous. So it's that targeted ability to support employees at the point of need has more than straight line return. You said investment return on people. I don't know how to measure that, but I can measure it in terms of the sentiment we get from employees by doing these things. And I can be specific on some of the comments that come back from employees.
No, that's really key in employees and how they feel about the business, how they feel about the company that they're working with. You've been working, as I said earlier, you've been working with Reframe for 2 years. Tell us a little bit about how that started, and just kind of thinking of that kind of real world case, how that all came about.
Well, simply put, this is a company that cares about employees and tries to do the right thing. And the actual example, I think it's a little more than 2 years actually. We had an employee in the UK who was diagnosed with cancer, and the company was just anxious to help. And so managers were anxious to help. We're fortunate to have resources, so we did everything possible to help that employee, and we had no idea how to help. What was the right way to employ? So there was a lot of good intent and not a lot of good execution, because we were not skilled in doing that. And frankly, reframing, I think it was called Cancer Concierge at that point, was a Google search, because we were looking for something to help us in that space. And we tried it with that employee, and then we tried it as a trial case. And from that, it became clear that this was just a benefit that was central to our values, which is the main thing, and was helping employees at their time of need. So that's where it came about from. I'd love to say it was because we thought about the diversity, equity, and inclusion plan for that, but it wasn't, although it ties absolutely into the narrative.
I think you, when we were talking about this earlier, you were talking about how originally the planning around this particular employee was not necessarily going to get the best outcome for them. And you made a point about, you can do the wrong thing to do good. Can you talk about that?
Yeah, I mean, actually, a slightly different example. So the ethos of the company, this is a San Francisco-based company. We've got a CEO who has personally stood up and supported employees and the broader community. That's what he's done. But we had one situation where an employee had a cancer diagnosis. It was actually a Canadian employee, where the company stepped in and brought that employee to UCSF, the hospital in San Francisco, for treatment. It's a fantastic hospital. It's leading edge. But the point here was that employee could have been treated in Canada, where they were. So by trying to do good, we took that employee, we brought them to where we knew treatment could happen, and we invested money in that. But what we did there was we took the employee out of the home environment. That means the family were not there, so then there was cost to bring them. They had to stay in hotels. This was a serious case. It was not short term. We did not deliver the best experience for that employee, even with the best of intent and actually huge sums of money. We could have had that person stay at home and get exactly the same treatment and had a better outcome. So I think that was it wasn't a UK case, but it was a clear example of trying to do good, but not ending up with the right outcome. And therefore having a structure with people who actually know what they're doing in the space is critical to get the right outcome.
No, absolutely. That's a really good point. Before I just ask my next question to both of you, really, and to have a discussion about this further, just to say to everybody who's joined today, if you have any questions that you'd like to put to Catherine or Richard, please do include them in the chat at the bottom of your screen, and I will circle back in a few moments to ask those as well. So please feel free to put those, or put your hand up if you'd like to ask that question directly. So how then do businesses thinking about this? I want to do something about this and provide more and better cancer support for my employees. How can they get started? Catherine, I think you have a kind of 5 steps in the white paper that businesses can go through, but what would your advice be there?
I think I would start by actually going and talking to employees who have had cancer whilst being in employment, and actually getting their feedback and understanding from them how they found the experience and how they found the support from the organisation. Because I think that gives you a really good understanding of the baseline of where you're starting. I think secondly, it's really understand, do your managers know how to handle this? Do they have the training they need in order to support that? I think thirdly, it's regular communication so that people are aware of what support they need. I know that actually employee benefits is one of the key challenges for HR teams in terms of actually just making sure that employees actually know what's available to them, and just making sure that they know what cancer support is available. Because certainly when you're in the moment of dealing with a potential diagnosis, you're not necessarily thinking that clearly. I think fourthly, making sure that your policies are cancer friendly and give the support that they need. And finally, making sure there's just a general awareness in the business that it's okay to talk about this, and that the business is geared up to support people who have cancer. So those are the 5 steps that I recommend for really an organisation taking stock of where it's at and what it needs to do.
Richard, anything you'd like to add to that list?
Well, I think I described how we set off on our journey. One of the learnings I would share here is that how you set this up, I think, is important. So at the point where you've offered a support to employees in a situation where literally this can be life-threatening, we did a try. I mentioned that we started off the arrangement in one case, and we supported that individual, and then we had a follow-on case where it was actually a dependent and the employee's wife, and we supported before we set up the framework formally, and we supported on an ad hoc basis. And what I mean by that is we had not defined the parameters of the support, and that became a situation where the employee was kind of pushing the boundaries of experimental treatments. And then you're in this point of something is identified, and are we willing to fund? And there's no parameters around about that. And that felt a very awkward situation. And I don't think we were being fair to the company. We weren't being fair to the individual in terms of the potential expectations of the support that was there. So one learning that we had was put a framework round about this as to what extent you're willing to go to. You cannot solve everything here. Cancer kills people, and that may well be the outcome. So you can't end up in a situation where you're going to have infinite funds to deal with any potential outcome. So putting some sort of framework there, although it sounds a bit callous, it's actually helpful that employees know what is the scope of what's available to support.
I think that's a good point. And Catherine, I guess there might be a tendency at the start of this journey to think this issue is too big once we start looking into all the various elements. But practically, there are things that can be done, aren't there? And as Richard said, a framework is a good starting point to that.
Yeah, absolutely. And the philosophy with Reframe in terms of dealing with the individual is actually to put them in a situation where they can manage their own health. There are a lot of decisions they're going to need to make, and they need to understand what is and isn't available to them. So to Richard's point, just helping them understand what benefits they can get, both through their employer, but actually also other benefits. We quite often will involve charities where it's appropriate in supporting clients as well. So, in empowering the individual to understand where they're at and what they need, actually puts them in the best possible position to make the most of their situation. And as Richard said, there isn't, unfortunately with cancer, there isn't always a happily ever after, but what you can do with everyone is actually allow them to have the best possible outcome given where they find themselves.
I think, as you were saying, Richard, it's not just the kind of the big health issues or the kind of the pathway to healthcare. It's things like it's the thing like getting fuel in vehicles. During the petrol crisis, how are you going to get to your treatment, and what are the practical steps to that? And all those things, I guess, could be part of that framework.
Yeah, I mean, the first case that we actually had, literally in the end, the biggest support we gave was the getting back and forward to the radiotherapy treatment every day. That was actually probably the biggest step we took. So in that case, that was what was important. There was logistics to be give support on.
Yeah, an awful lot to think about, a lot for companies to think about, but a clear pathway through to that. And actually, a question we've got from Darren Mooney. Darren's asking, and he's asking this for you, Richard. How do you make your staff aware of benefits like cancer support from Reframe?
Yeah, it's a great question, and on the surface, a simple question, but it's actually not that simple. And Catherine kind of touched on it there. This is about awareness of, and I apply this to benefits in general. So for benefits to be useful, people need to be able to access them at the point that they need them. And the more benefits you have, the more difficult it is to know everything that's out there. And I very often have a conversation with employees who maybe talk about something, so we've got this benefit, and they have no idea. So it's an ongoing thing that we need to do, Darren. And we use a few tools. So one is we have a benefits platform so all our benefits are in the platform. We happen to use Benefix as a partner. So that means our benefits are in one place for employees. It's nicely branded. It's very easy to get, so you can see what benefits are there. We also work hard with our partners. So we've always had an EAP provision in place. We've just actually moved that onto a global platform that allows us it's easier for us to make connections. So meaning that if we're getting a call into our EAP provider, they're aware of what other benefits we have. And so if they get a call, if someone calls for this reason, they're able to make the connection, make the link to say, do you know we've got the cancer support program in place? Same with our medical providers as well. So it's an ongoing, it's a mix of different tools, but you have to work hard on that to actually make sure people are aware. And so, we use periodic comms as well, just as reminders. None of that is perfect, but so it's an ongoing task, and a great question.
And Catherine, just kind of leading on for that, everything's set up. Someone unfortunately has a cancer diagnosis. What happens then? What's the kind of that first 30 days, and how does your team then interact and know when to interact? How does it all work?
It all starts from actually identifying what it is that the person who's contacted us needs. So we start off with them, just having a conversation with them, understanding their situation, understanding what's important to them, and understanding also where they are psychologically, in terms of, are they in that space of just give me some information, please, and I'll go off and handle this, or are they in a position of actually they need a lot more support? So it really is driven from the client and what that client needs at that point in time. And indeed, the expectation will be that will change. And then depending on the outcome of that conversation, that may lead to us setting them up with one of our cancer nurse specialists, who will spend some time with them talking through the medical side of their situation. And in more and more we actually have, now that obviously we're all used to doing things with Zoom and so forth, actually doctors very often will be having a lot of their consultations now online, and we end up often with our nurses actually being invited by the clients to attend, because as I think a lot of people are aware now, when you're in that moment and being given information, more than half of people actually don't absorb what's been said, and they find it really helpful to actually have a nurse alongside them who afterwards can almost do a debrief with them and help them understand exactly what it is that they've been told. So it can be really getting involved in the medical side, or it can be sorting out the practical aspects. It really depends on exactly what it is that the client needs, and then again, as part of that, with the client what they would like the ongoing support to be. So whether or not they want us to contact them on a regular basis, or whether or not they want to just reach out to us as and when they need it. And again, sometimes we have some people who will go through a stage where they're actually ringing us every day, and then sometimes we won't hear from someone for a month or so, and then they'll reach out to us. Really depends.
I guess it's just knowing. Oh goodness, that hadn't. I mean, sometimes you just don't know what you don't know.
Exactly.
So it's just that reassurance. What do I do about my bank account, or what do I do about to my appointments, and understanding that's there. And an observation and question from Russell Turner, just to say, as a cancer survivor, the single most important factor was knowing that my family would be okay and that my job was safe. My company told me this immediately. It made a huge difference psychologically. Shouldn't all businesses? Yeah. And I guess, one would think, why wouldn't that be the case? But I guess that isn't always the case.
No, I think that's a great point, really well made. Yeah, and again, it just adds to the anxiety. You're dealing with this and you're worried about your job security, and I'm always surprised at how prevalent that is still nowadays. So that upfront conversation can be hugely helpful to everyone concerned. That reassurance.
And just to add to that, I feel kind of privileged that I work for a company where that's almost a no-brainer. That point, but I know that's not the case everywhere. And just coming back to your point, Rose, about return on investment. I mean, there's a commercial reason why you should do this. So in the very short term, you can look at this as there's an employee who's sick and is not contributing to the business, but there's a much broader picture to that. That's an employee who can hopefully get better, who can contribute to the business. But the broader picture of supporting employees, whether it's through cancer support or any other benefits, I see benefits as one of the reasons that we're contributing to the success of the business is that we're helping employees to do their best work. And that's the context of this. You're supporting through the good times, you're supporting through the bad times. And if you look at it in that broader picture, I think you come to that outcome that Russell clearly valued there. But you have to look at it from that lens.
Yeah, that's absolutely right. And I just something then that you were saying as well earlier, and we were talking about kind of private health and companies that offer private health. If a company already has private health as a benefit in place, how does Reframe work with that or complement that?
So Reframe is definitely complementary. We are agnostic of employee benefits from that perspective. So we have we have clients who are getting all of their treatment on the NHS. We have some clients who have all of their treatment through PMI. We are agnostic from that point. The thing that Reframe is doing is supporting people as they navigate the experience of having cancer, and the private medical insurance will be one of the parts that we help them navigate, help them understand what support they're eligible for, help them understand how to make claims if they need support on that. So that is a mechanism by which medical treatment is delivered, but Reframe is there for providing support to that experience of having cancer.
And Richard, anything thoughts from you on that?
Yeah, I mean,
how it works at Salesforce.
Yeah, I totally agree with what Catherine says. We have a very comprehensive cancer care within our private medical plan, but these are definitely complementary, because what I see the Reframe piece adding is helping employees to join the dots. Because this is an overall experience. One part of it is the medical care, but as we said before, one part of it may just be logistics. It may be emotional, and the medical care, in my experience, doesn't necessarily join these dots so well. So this is about having the ability to have a conversation with someone who understands the landscape. They may not be the surgeon. In fact, they won't be the surgeon. But they understand the landscape, they understand the terminology, they can help you through it, they can guide you to the resources, what you can do, what you can't do, even just understanding the language that's been used, to the point of, this is what's been said to you, this is what that means. Because you can go to, in these kind of appointments, an employee or dependent may go to, you're hearing some things you don't want to hear, and you don't necessarily fully take in everything. Having the ability to have that conversation with someone who can just help you to understand what was actually said there, and what are the next steps. That's different from the person who's actually giving you the medical care. So I see these as absolutely complementary.
Yeah. And actually that leads on to a question that I know Tim Warren was asking earlier, and that's that the NHS is brilliant when it comes to serious illnesses like cancer. We know that, we've all and seen that. So what's missing? What are the kind of other elements that are missing? We've talked about some of those already, that an employer can support with and that can complement all that great work that the NHS is doing. And I think a lot of what we've been talking about is helping to alleviate the things that happen outside of that care. Is there anything else that both of you would say?
So I think I agree with you. And the NHS is willing to, as I said, Reframe is agnostic around who is supplying the medical care. I will say that at the moment with COVID, we are seeing a massive increase in anxiety of people unable to get GP appointments, unable to get delays in getting testing and so forth. So actually one of the things that Reframe does is really help people expedite things. You know, if you're really worried and really stressed and might still be at work, then actually the pressure of trying to, you know, constantly pester and chase to get appointments and so forth is really difficult, and Reframe will take all of that off you. And Reframe can also identify other sources of support. So mental health, for instance, there are a lot of charities who will supply mental health, and we're seeing, again, I think partly as a result of COVID now, more than 3/4 of the clients that we are dealing with want some kind of mental health support as well, just because of the pressure and anxiety of what's going on. And again, Reframe can help support that. If medical insurance that gives you that, then fantastic. But there are actually an awful lot of other ways of getting support, and Reframe can help expedite that.
And that's something that's something for carers as well as those who've been diagnosed, which I suppose is a real danger, isn't it? That just how mental health is affected.
Yes. So Reframe, as well as supply as giving support to people who have the cancer themselves, we also can support the carers of people who have cancer, and very often they're actually bearing the emotional burden of helping cope with that. And I actually had a long conversation with a gentleman a few months ago. He just asked me what I was doing, and I explained to him I was working at Reframe, and he spent maybe 20 minutes talking to me about how traumatic he had found supporting his wife through breast cancer, because everybody was always talking about her, and actually he was finding it a massive emotional burden actually just supporting her, and he had nowhere safe to actually talk about himself. So I think that's a good point, Rose, in terms of actually the mental health of carers can be really important as well.
Lovely, thank you. And someone is also asking the thorny question of how much should businesses be thinking of investing in this, if not in absolute figures, as a percentage? How do you go about how do you go about putting that together, Richard?
Well,
without having to give any precise figures, but how do you approach that?
Well, we have a particular approach to the way we invest in benefits, and it's largely value led. When I say value, I mean in alignment with our values as opposed to the cost. So I think you start at the kind of benchmarking piece that says where are you in the market and do that kind of thing, but for us it's about the value. Is this important to us, and does it make sense financially? So we're not putting a return on investment figure on this. We're just demonstrating the importance to our employees versus the need that's out there. And as I said, I'm lucky to be in a company that values benefits, and kind of respects the fact that these things have an impact, even if I can't put an absolute dollar number on that. So that's how I come at these things. I would spend more on this. This product's it's available in the UK and Ireland for us. I've not seen this being available beyond that in a meaningful way, but it's something that I'd love to be able to do in other countries. But that's how I think about the cost versus value here.
Yeah. Yes, and a great ambition for the future. I think there's a point that Russell's made.
Rose, sorry.
Yes, sorry, Catherine.
I'm gonna give a very practical question and say our research, based on the interventions that we see on the statistics we know about the impact of cancer, says that involving Reframe can actually cut the cost for businesses of cancer by 33%. So I think actually, whilst whilst it's you shouldn't be doing because of an ROI, I think actually there is a strong case for a good ROI as well.
And sorry, I think your microphone cut out when you said the percentage. So that was 33%.
33%.
33%. Good. Just want to make sure everyone's clear on that. Yes, thank you. And Russell's again making a point about backlogs and why they're so frightening. And the point I think both of you made about being able to talk things through to help structure someone who's diagnosed in carer's thoughts and plans are quite vital in perhaps reducing some of that fear. Because of course, everyone in the UK diagnosed are immediately moved across to the NHS for treatment, whether they have private health insurance or not. So that factor of being able to talk things through and reason things out, and the things that might be totally worrying you, you could put to one side and focus on something else. That can actually have a very powerful positive and reassuring effect, given that there's and something that's in your control, I suppose, as opposed to backlogs which aren't in your control.
Yeah, for me, and I think I'm understanding what Russell's saying here, in that you mentioned the word control there, Rose, but the context for me is that in this situation, it's very easily for you to lose control. So, you know, you've had a diagnosis and you're there at that point dependent on the medical advice. And, you know, and some people are totally happy with that, but some people would like the opportunity to retain control and to understand the options and to make choices. And I think what this discussion, whether you choose to do it or not, whether you choose to act on it or not, gives you the opportunity to have a discussion to better understand the situation and therefore make your own choices on, because there are choices in terms of treatment methods. So having that view on options, I think, is an important option, and not everyone wants it. I think the most important thing is here, people have choices and want to do this in different ways, but this gives opportunities in order to make these choices.
Yeah, and just that recognition that people do have choices, and sometimes there might be a feeling that those choices are limited because you don't know until you've explored what those might be. Do keep, we've got about 3 or 4 more minutes. So if you've got any more questions, please keep asking them. I'd perhaps like to, just in terms of my final thoughts on this for both of you, is kind of what, 2 parts of the question. What should any of our guests on this webinar, what could they start doing tomorrow to progress this? And what's the result for business if you do nothing?
I'll let Catherine answer the first one.
So in terms of the guests, I think we're going to send out after this some sort of employer's guide to cancer, which actually takes people through key steps of things that they ought to be thinking about. And as I said, I think that starts with actually just get some feedback from your employees around what their experience is at the moment. And obviously, by all means, please reach out to us, and we will be happy to answer any other questions or take people through the Reframe process in more detail. In terms of consequences for business, I think we are only just at the tip of the iceberg of what the consequences of COVID and cancer are. As I said, it's very clear that late diagnosis lowers the likelihood of positive outcomes for cancer. That's, the Cancer UK clearly articulate that. And I think anything that business can be doing to support employees who are worried can only be a good investment for themselves in terms of actually what will happen longer term.
Thank you, Catherine. Richard, what are your thoughts here?
Yeah, I think it's probably not for me to answer for others. So I've explained our perspective on benefits and why we do things, and it is about employee engagement. It's supporting employees through the life cycle in all sorts of events that may happen during that time. You can take a view as a company to not do that. There are, we live in a country where there's a lot of great services through the NHS. But I think it's having that recognition that there are some options there to do some extra things that, in my view, for relatively small investment, has a very large return on the sentiment for employees and has an impact on the workplace if we can get ahead of things. And Reframe doesn't necessarily get you ahead of the cancer diagnosis, but it just gives more tools and options to help deal with it and give you a better chance. So, for me, it makes perfect sense. But I think you have to look at that within the context of your own business, where you put the emphasis on how you spend money and value things. So that's a call. But the fact that folks are interested in this topic and thinking about it is probably the main thing, and you'll figure out your own journey there.
Thank you. Well, thank you to both of you. I think that has concluded our session. It's been a fascinating conversation. Thank you both, Catherine and Richard, for being part of that conversation. And thanks to everybody for joining us this morning. We will be following up with a copy of Reframe's white paper. We have recorded the session and I'm sure we'll be sending out a digest of that as well. But in the meantime, I'd like to thank both our guests and to thank you all for joining this morning and hope you have a good day.
Okay, thank you.